If you close your eyes right now and think back to your school days, I'm I'm willing to bet you can picture the cafeteria almost instantly.
Oh, absolutely.
You can probably see the industrial grade plastic trays.
Those long foldable tables.
Yeah, exactly. And maybe even remember the chaotic noise of 100 kids talking at once. We all remember school lunches.
It's a very vivid shared memory.
It is. But what if I told you that those highly familiar, seemingly mundane cafeteria trays are actually the front lines of a massive, critical, global health shift?
It's a fascinating perspective to take, honestly, because we typically look at the school cafeteria as just a holding pen, really.
Right, just a place to eat.
Yeah, a place for kids to eat and socialize between math and history classes. But when you zoom out to a global scale, that room is a highly contested environment where lifelong habits are forged.
Right, and that's exactly what we're getting into today. Welcome to our deep dive.
Glad to be here.
For this discussion, we're zeroing in on a single, highly impactful source. It's a January 2026 news release from the World Health Organization. It's titled, WHO Urges Schools Worldwide to Promote Healthy Eating for Children.
It's a really pivotal document.
It really is. Our mission today is to unpack these new global guidelines and really understand why the mechanics of a school cafeteria have profound, lifelong consequences for global health.
Definitely.
And I can tell you're ready to dig into this because I see your backdrop has completely changed today.
It has, yeah.
You've got this vibrant, complex blueprint of a modern school cafeteria, but it's totally overlaid with shifting global health statistics. I see you highlighting some key figures on your notepad already.
I am, actually, because the numbers we're looking at today require a lot of context.
Mm-hmm.
They paint a picture of a world in a very rapid, complex transition. Mapping those macro statistics directly onto the microenvironment of a school cafeteria, well, it really helps visualize exactly where public health policy hits reality.
Okay, let's unpack this. Because the data the WHO released here really caught me off guard.
I'm not surprised.
The World Health Organization points out that childhood overweight and obesity are rising globally.
Which, isn't breaking news on its own.
Right, we've been hearing that for years. But they give a specific statistic for the year 2025, and the scale of it is just massive.
It is.
As of 2025, about 1 in 10 school-aged children and adolescents worldwide are living with obesity.
Yeah.
That's 188 million kids. Let that sink in for a second. 1 in 10 totaling 188 million children.
It's a staggering figure. But what makes that 2025 statistic so critical isn't just the sheer volume.
What is it then?
It's the historical weight behind it. The WHO highlights that 2025 actually marks a major demographic tipping point.
A tipping point.
Yes. It's the very first time in human history that the number of children living with obesity has globally surpassed the number of children who are underweight.
Wow. The first time ever.
Ever.
That fundamentally shifts how we have to think about global malnutrition.
It completely rewrites the playbook.
Yeah.
And the text introduces a vital concept here called the double burden of malnutrition.
The double burden.
Right. Historically, when people heard the word malnutrition, especially in the context of global health or developing nations, they instinctively thought of undernutrition.
Like caloric deficits,
Food insecurity, exactly. And the WHO is very clear that undernutrition remains a persistent, ongoing crisis in many parts of the world.
Of course.
But malnutrition literally just means bad nutrition, which encompasses obesity and micronutrient deficiencies as well.
Right.
So we're now facing this double burden where both extremes are presenting massive hurdles to global health simultaneously, often within the exact same country or even the same community.
That's incredible to think about.
And schools are quite literally ground zero for fighting both of those extremes at the exact same time.
But practically speaking, how does a single institution manage that? Because the kids facing undernutrition are relying on the school for essential life-sustaining calories.
Right, that might be their only hot meal of the day.
Exactly. Meanwhile, the kids leaning toward obesity need the school to provide nutritionally dense, balanced options rather than highly processed empty foods.
Yes.
The school is being asked to solve two entirely different physiological problems on the very same lunch line.
And that is the core challenge. The school environment has to be engineered to provide baseline nutritional security without over-relying on cheap, ultra-processed calories.
It's a tough balance.
It is. There's a quote in this release from the WHO Director General, Dr. Tedros Adhanom Ghebreyesus, that synthesizes the stakes perfectly.
Oh, what does he say?
He says, "The food children eat at school and the environments that shape what they eat can have a profound impact on their learning and lifelong consequences for their health and well-being.
So he's drawing a direct line from the nutritional profile of a Tuesday lunch tray.
To the chronic diseases a person might face 4 decades down the line.
Yes, which makes total sense when you consider the sheer volume of time children spend in these buildings. It's not just an academic center, it's an environment that actively shapes their dietary baseline.
Exactly. If healthy dietary practices begin early in life, as the WHO notes, then the school environment is arguably the most powerful lever we have for reducing health and nutrition inequities.
Because you have a captive audience.
A captive audience during their most formative developmental years.
But here's where I ran into a massive contradiction of the text, and I want to get your take on this.
Okay, let's hear it.
The WHO points out that today, there are an estimated 466 million children receiving school meals globally.
Nearly 500 million kids.
Nearly 500 million. Yet, according to the text, there remains limited information available about the actual nutritional quality of the food they're being served.
Yeah.
How is that even possible? We're running a massive global feeding operation, but we don't actually have good data on the macros and micros we're handing out.
What's fascinating here is the absolute vulnerability that this lack of data exposes.
Vulnerability in what way?
Well, if you're a public health official operating on a global scale, trying to combat a highly complex double burden of malnutrition, you're essentially flying blind.
Because you don't know what's in the food.
Exactly. If you don't know the nutritional breakdown of those 466 million daily meals, you can't fix what you can't measure.
But why is the data missing? Is it just bureaucratic incompetence, or is it a structural issue?
Oh, it's highly structural. Think about the logistics of global school food procurement. It is incredibly decentralized.
I guess that's true.
You have some schools cooking meals from scratch, using local agriculture, which varies by season.
Right.
You have other districts relying entirely on private, multinational mass catering companies.
And then there are places where food is brought in by independent vendors.
Unregulated independent vendors who just set up shop near the school gates. The auditing infrastructure required to capture consistent, accurate nutritional data across all those varying supply chains simply doesn't exist in most parts of the world.
So it's not just a missing spreadsheet.
No, it's a systemic black box.
So we have a demographic tipping point in childhood obesity combined with a massive global blind spot regarding what we're actually feeding these kids.
Exactly the problem.
Which brings us to the actual solution the WHO is proposing in this 2026 guideline. Because of these factors, for the very first time, the WHO is advising countries to adopt what they call a whole school approach.
The whole school approach is a crucial paradigm shift. In the past, policy efforts were incredibly myopic.
Meaning they just looked at the lunch line.
Right. They might have focused strictly on the nutritional content of the hot meal being scooped onto the tray, lowering the sodium in the soup, or swapping white bread for whole wheat.
Good steps, but not enough.
Not nearly enough. The WHO is explicitly stating that this narrow focus is no longer viable. The whole school approach ensures that all food and beverages provided in schools, and critically, everything available throughout the broader school food environment, must be healthy and nutritious.
Right, because kids aren't just eating the hot lunch.
Exactly.
So this approach targets the vending machines down the hall, the snacks sold at the student store,
Concessions at after-school sports.
even the fundraisers. The entire ecosystem of the school has to align with these nutritional goals.
Because if it doesn't, the ecosystem is fundamentally undermined.
How so?
If a school spends its budget perfectly balancing the macros of a hot lunch, but a student can just walk 50 feet to a vending machine and buy a hyper-palatable, heavily processed, sugary snack.
Then the policy has failed.
Entirely. The environment has to universally support the desired public health outcome.
Okay, here's where it gets really interesting. Because the WHO doesn't just say, make the ecosystem healthier and leave it at that.
No, they are very specific.
They break this down into 2 specific recommendations in their playbook. And the first one is what they call a strong recommendation.
Right.
This is the hardline policy approach. The text says schools need to set strict standards to increase the availability, purchase, and consumption of healthy foods while actively limiting or banning unhealthy foods.
That's the foundational regulatory level. You have to establish a hard baseline.
Meaning, if it's not healthy, you just can't buy it.
Right. If the unhealthy food simply isn't physically present to be purchased, or is strictly limited by a standardized metric like a cap on added sugars per serving, you're instantly elevating the baseline nutrition of the school.
I get the theory behind the strong recommendation, but let's be real for a second.
Okay.
We're talking to an audience that understands how local school districts operate. A lot of underfunded schools heavily rely on the revenue generated by those lucrative vending machine contracts
They absolutely do.
or junk food partnerships just to fund extracurriculars or even basic supplies. Does the WHO address the economic friction of just banning the profitable junk food?
The text we're reviewing focuses strictly on the health and behavioral outcomes, but you're hitting on the exact friction point that local policymakers face.
It's a huge barrier.
Banning lucrative, highly processed foods creates an immediate budget shortfall for many districts. This is why a global guideline is so difficult to execute locally. The WHO is providing the ultimate health target, but local municipalities have to figure out the economic puzzle of replacing that lost revenue. And that's actually why their second recommendation is so vital.
It's not just about banning things.
No, it's about altering behavior.
Yes, the second recommendation. The WHO labels this as a conditional recommendation, and it focuses heavily on implementing something called nudging interventions.
Nudging.
Right. They're actively recommending that schools use nudges to get children to select, purchase, and consume healthier options.
This is where behavioral economics and choice architecture enter the cafeteria. According to the WHO guideline, a nudge can include a change to the placement, the presentation, or the price of the food options.
Now, anyone who follows behavioral economics knows that choice architecture is incredibly powerful. But how does it specifically apply to a school environment? Why is the WHO relying on nudges rather than just sticking to strict bans?
Because strict bans often create pushback.
Like black markets for candy?
Exactly. Or students just leaving campus to buy junk food at the convenience store across the street. Nudging is more insidious, in a good way.
How did that work in practice?
Think about the cognitive state of a child or teenager in the middle of the school day. They're dealing with significant cognitive load and decision fatigue.
They're tired.
Very tired. By the time they hit the cafeteria, their prefrontal cortex is exhausted. They aren't making highly rational, long-term nutritional calculations. They're making impulsive, energy-seeking choices based on what is easiest and most appealing in that exact second.
So if you put a highly processed, brightly packaged snack right at the checkout register...
You're essentially weaponizing their cognitive fatigue against them.
Wow. So the environment is doing the deciding for them.
Exactly. So the WHO's nudging intervention flips that dynamic. You alter the choice architecture.
Imagine a cafeteria where the fresh fruit is placed right at eye level and priced cheaply.
Perfect example. You make it the absolute path of least resistance. You subsidize the cost so it's the cheapest option.
And the less healthy stuff.
You improve the lighting and presentation around the healthy options, while moving the less healthy options, if they haven't been banned entirely, to awkward, hard-to-reach shelves at the back of the room.
And you price them at a premium.
Right. You aren't necessarily stripping away the student's autonomy, which reduces rebellion, but you're heavily weighting the scales so the healthy choice requires zero willpower.
You're designing an environment where the default behavior is the healthy behavior.
And this raises an important question. When we utilize these psychological nudges day after day, year after year, during a person's most formative neurological stages, how deeply are we shaping their lifelong decision-making processes?
That's a profound thought.
If a child is consistently nudged by their environment to see whole, unprocessed foods as the default, easy and appealing option, does that neural pathway become so deeply ingrained that at age 30, 40, or 50, they instinctively bypass the ultra-processed snacks in a grocery store?
The WHO is banking heavily on the idea that these early, externally nudged behaviors will eventually internalize into permanent dietary habits.
It's a very ambitious public health strategy.
It is. But, as with all global directives, having a brilliant behavioral playbook is only half the battle. The text acknowledges this reality head-on. They clearly state that having policies on paper is essentially meaningless without robust implementation.
Absolutely. The text points out that monitoring and enforcement mechanisms are essential to ensure these guidelines actually translate into reality.
Because without audits...
You can design the perfect choice architecture, but if nobody is auditing the cafeteria manager to ensure they're actually placing the food correctly, the whole system reverts back to the easiest operational baseline.
And the data backing this up shows a massive structural gap between what's on paper and what's happening on the ground.
Yes, the GIF&A data.
Right. The text cites the WHO Global Database on the Implementation of Food and Nutrition Action, which they abbreviate as GIFNA. As of October 2025, the GIFNA database shows that 104 member states do actually have policies on healthy school food.
That sounds like good progress.
It does, and almost three-quarters of those include mandatory criteria to guide the composition of the school food. So a significant portion of the world has the rules written down.
But there is a glaring loophole that the WHO highlights immediately after that statistic.
Yes, the marketing gap.
Exactly. While 104 states have healthy school food policies, only 48 countries have policies that restrict the marketing of foods high in sugar, salt, or unhealthy fats.
Only 48, so less than half of the countries that mandate healthy food also bother to restrict the marketing of the unhealthy food. That feels like a massive oversight.
It is. And if we connect this to the bigger picture, you can see how devastating that specific enforcement gap really is. We just talked about the whole school approach and choice architecture.
Right.
Now imagine a public school in a country that legally mandates strict nutritional criteria for the lunch tray. The school administration works hard to meet that criteria. But because there are no national restrictions on marketing, that exact same school environment is flooded with commercial influence.
So you're serving a nutritionally balanced lunch, but the scoreboard on the football field is sponsored by a multinational soda company.
Exactly.
The vending machines are wrapped in glossy advertisements for energy drinks. The educational materials might even be branded by fast food conglomerates.
Precisely. Having a mandatory rule for the lunch tray is completely neutralized if the child's broader environment is still actively engineered by billions of dollars in commercial marketing to crave ultra-processed foods.
It's an unfair fight.
The marketing dollars are actively fighting the public health policy, usually within the same building. The whole school approach collapses if you allow commercial entities to dictate the visual and psychological environment.
It's a tug of war for the students' attention and habits, which explains why the WHO had to bring together a very diverse, multidisciplinary group of international experts to develop this guideline.
They needed a broad perspective.
Right. They noted it went through a rigorous, transparent process. They clearly recognize that they aren't just dealing with nutritionists. They're dealing with a complex web of agricultural supply chains, behavioral psychology, and aggressive commercial marketing.
It's highly interconnected.
And this specific guideline is positioned as a cornerstone of the WHO's broader mission, tying into larger initiatives like their acceleration plan to stop obesity and the Nutrition-Friendly Schools initiative.
But they also make a very necessary concession in the text.
What's that?
The WHO cannot enforce this from an office in Geneva.
No, they can't.
While this is a massive, coordinated global initiative, the text specifically calls out subnational and city authorities. It explicitly states that local municipalities play the key role in advancing and implementing these school food initiatives.
Which brings us back to that logistical nightmare we discussed earlier. A global health organization can provide the blueprint, they can host the launch webinars, and they can offer technical assistance and knowledge sharing.
But they don't hold the clipboard in the cafeteria.
Exactly. The ultimate success or failure of this global policy falls on the shoulders of local city councils, subnational health boards, and local school district superintendents.
They are the ones who have to fight the local battles over vending machine contracts.
Right.
They are the ones who have to enforce the marketing restrictions against well-funded local pushback.
Yeah.
The macro strategy is global, but the tactical execution is intensely local.
It's a massive, synchronized team effort required to shift a system this large.
It truly is.
So what does this all mean for you listening to this deep dive right now? Even if you are completely removed from your school days, even if you don't have children navigating these cafeterias, you are inextricably linked to this global shift.
We all are.
We are talking about 466 million children sitting down to eat a school meal every single day. The children eating those meals, navigating those heavily marketed environments, and internalizing those behavioral nudges, they are the adults of tomorrow.
Future global workforce.
Yes, they are the future leaders, and critically, they are the future patients of our global healthcare systems. If we get this right, if we successfully implement these whole school approaches, as Dr. Tedros suggests, we are actively preventing chronic disease decades before it manifests.
We are drastically reducing global health inequities.
We are literally shaping a healthier future population, and it all starts by rethinking the underlying architecture of a simple plastic cafeteria tray.
I think that's the perfect framing.
Yeah.
And I want to leave you with a final thought to mull over long after we wrap up this discussion today.
I love a good final thought.
We've spent our time analyzing how these WHO guidelines aim to shape lifelong habits by rigorously controlling the microenvironment of the school. But think about the macro implications of that success. If we successfully utilize choice architecture to nudge an entire generation, 466 million children daily, to instinctively prefer and demand healthy, whole, nutritious foods, how will that massive demographic shift ultimately force the broader global food market outside the school walls to fundamentally alter its supply chain and commercial offerings to meet their future demands?
That is an incredible thought to end on. If you change the demand in the cafeteria today, you force the global market to adapt tomorrow. Thank you so much for joining us on this deep dive. Keep asking the hard questions, keep analyzing the hidden architecture of the environments around you, and as always, stay curious.